2014 West African Ebola crisis. The lessons learned from the Ebola outbreak revealed that in addition to weaknesses in health systems, slow and unpredictable funding was a major contributing factor to the inability of the affected countries to rapidly respond to the initial outbreak. Well, in its capacity as a specialized agency of the African Union, the ARC is planning to launch the ARC Outbreaks and Epidemics parametric product in 2020 as part of the AU's overall response to outbreaks and epidemics. The Outbreaks and Epidemics program comprises of significant in-country capacity building work on preparedness and contingency planning for outbreaks and a risk transfer parametric product that aims to cover early response costs of an outbreak. Well, for more on this, we now have on the line Mr. Mohamed Beavogui, who is the United Nations Assistant Secretary General and Director General of the African Risk Capacity. Thanks so much for joining us, and we're hoping that you might be able to share some solutions for us for sub-Saharan Africa in combating and flattening the curve for COVID-19. Thanks for joining us. Tell us a little bit about the lessons learned from Ebola that you're hoping to bring across to be better prepared and manage this virus.
Yeah. Good afternoon. Thank you very much for having me first and giving me the opportunity to speak a little bit about what we are trying to do. The African Risk Capacity, as you said, is a specialized agency of the African Union that was established, in fact, to help African countries to understand, manage, and finance disaster risk. Of course, we started our work with climate disaster risk, and very quickly, the tool became extremely useful for the countries that didn't have enough resources and understanding of climate-prone disaster risk. In 2014, when Dr. Zuma, Madam Zuma, was still chairwoman of the African Union, she spearheaded the launch of this program. And at the request of the African Ministers of Finance, we started the Outbreak and Epidemic program. In fact, as you just explained, what came out from the Ebola crisis was the difficulty to access resources in order to respond very quickly. But overall, countries didn't know the risk profile in terms of diseases. They didn't have system of early warning, and they didn't have response plans. And more, even for those who have response plans, they didn't have the resources to finance those response plans. Hence, the Outbreak and Epidemics program was launched, and we started working on 4 diseases. The 4 diseases were Marburg, meningitis, Ebola, and Lassa fever, because these were, following a research, the diseases that were most, I will say, threatening the continent. The experiment was conducted since then in Guinea and Uganda, and now we are ready. We are ready to launch the product, and we were just planning to launch it when this whole COVID-19 disaster started.
So you're ready to launch, but the question might be, has the horse already bolted? Is this launch happening too late, or can you still have an impact on this current epidemic? Because in Africa, I guess we're still at the bottom of the curve.
Yeah, as I just mentioned, the product as it is now is for those diseases I mentioned. But it is very easy to work and turn the model to adapt it to COVID-19. You must understand that it is very important for a government to model the trends and the behavior of the disease in their country. And one aspect that is extremely important in what we are doing for those diseases is the capacity building aspect. The process we are in allow countries, as I said earlier, number one, to define the risk profile, to be prepared really, to have an early warning system, but also to link those response with financing. And we are now turning very quickly and trying to adapt the model that was prepared for Ebola to COVID-19. We hope that within very near future, we will be able to give African government, in coordination with the African CDC, will be able to give government tools that allow them to monitor the behavior of the disease.
All right, so I would imagine that this requires the cooperation of the African governments to make sure that this model is fed with the right information.
Yes, you see, unfortunately, we were supposed to present the results of all this exercise to the last Ministers of Finance meeting to be held in Accra 10 days ago. Unfortunately, the meeting was cancelled because of this same COVID-19. So it was to present to them the result also that we obtained on launching, on introducing this product to the market, which was very, very highly, quickly accepted and overwhelmingly, I will say, accepted. So now we are just informing governments by correspondence, and we are continuing the work and make sure that the product is available not only for those diseases that we are working on already, but this new COVID-19 that took all of us as a surprise, because none of us was expecting this one. We're looking at those diseases that we used to have and were creating a lot of problem on the continent. And here we have another one that came and creating problem for the whole humanity.
So what sort of timeline are we looking at for this new model to be functional and actually useful?
So it's difficult in science just to predict this kind of I will say, results. But we are trying to do our best. So within a very limited number of days, I will say less than a month, we want to work to make sure that we have a very solid and robust product. This is science.
All right. What do you think will be the impact once it's running, once it's able to do what you hope it does? What will be the significant difference using this model?
Number one, countries can test if they are prepared, and you can do it not only at national level, but at sub-national level, at county level. Remember, we like to say in ARC that every life counts. We should not look only at cities, but we also have to look at the small communities. That's where actually the biggest challenges are. So this model will allow to assess very quickly if at that level already we are ready or if we are not ready and what should be done. That's number one. Number two, it will help to put up a framework in order to organize preparedness. Preparedness is extremely important in terms of intervention. You must know what you need in terms of hospitals, in terms of tools, in terms of containment, etc., etc. So that's second one. And the third one is a response plan. You need to have that response plan. And then finally, what is the cost? Costing of all this intervention is extremely important for government. They need to know if they have the means, and if they don't have the means, how they can develop them, how they can find them, mobilize them very quickly.
All right, Mr. Beavogui, we're going to have to leave it there, but thanks very much indeed for sharing your thoughts with us about this important modelling that's available soon through the Africa Risk Capacity Programme under the tutelage of the African Union, and certainly will make significant difference once it gets off the ground and is deployed. All right, we're going to take a quick